For this lesson, it would be useful to have your body orientation worksheet printed so you can follow along. One of the first things we need to establish is a language for anatomy. The reason why special terminology is used is to prevent misunderstanding. So for surgeons and physicians, they're able to quickly communicate areas of the body. So exact terms are used for position, direction, regions, and structures. Anatomical position is referring to when the body is erect, the feet are hanging at the sides, palms are facing forward, and the face is facing forward. Superior is towards the head or upper part of the body, while inferior is away from the head or towards the lower part of the body. Anterior is the front of the body, posterior is towards the back of the body. Medial is towards the midline. So the midline is an imaginary line that divides the body into right and left halves. Lateral is thus away from the midline. Proximal is closer to the point of origin. Distal is farther from the point of origin or attachment. Superficial is towards or at the body surface. Deep is away from the body surface. So take a minute to pause the video and practice with question 5 on your worksheet. Let's see how you did. The elbow is proximal to the wrist. The liver is deep to the skin. The mouth is medial to the ear. Using regional terms is also a quick way to communicate areas of the body. So we're first going to take a look at the anterior view. Axillary is referring to the armpit, brachial to the arm, buccal to cheek, carpal is the wrist, like carpal tunnel, cervical is the neck, digital is fingers and toes. In the digital era, we use our fingers frequently. Femoral is the thigh, like the femur of the. Inguinal is the groin. Orbital, the eye area. Patellar, the kneecap. Sternal, the breastbone. Tarsal, ankle. And thoracic is the chest area. So let's take a look at the posterior view. We have deltoid, which is the shoulder area. Gluteal is the buttocks. Lumbar is lower back. And occipital is the back of the head. We can also divide the body into planes and sections. So a sagittal section is an imaginary line that divides the body into right and left parts. Transverse is an imaginary line that divides the body into superior and inferior parts. Frontal, an imaginary line that divides the body into anterior and posterior parts. So take a moment to pause and answer question 9 on your worksheet. So how'd you do? A frontal plane will divide the body into front and back portions. Transverse plane is going to divide the body into superior and inferior. Sagittal plane divides the body into right and left portions. We also have body cavities. Our dorsal body cavity is where we have our cranium and spinal cavity. The cranial cavity houses the brain. Spinal cavity houses the spinal cord. In the ventral body cavity, we have the thoracic cavity, which houses the heart, lungs, and others. Abdominal pelvic cavity, which houses the digestive system and most of the urinary system organs. So here's a view of the dorsal body cavity, which again includes the cranial cavity and the spinal cavity. The ventral cavity again includes the thoracic cavity, the chest, and inside the chest we have pleural cavities. Anytime you see the word pleural, that's referring to the lungs. Pericardial cavity surrounds the heart. Cardial means heart. peri means around, so pericardial, around the heart. Abdominopelvic cavity includes the abdomen, which contains the stomach, spleen, liver, pancreas, kidneys, and intestines. The pelvic cavity contains the reproductive organs, the urinary bladder, and the rectum. Finally, we can divide our abdominopelvic region into quadrants and subregions. So take a moment to fill out your questions on your worksheet related to quadrants and abdominopelvic regions.